This video is brought to you as part of the Paired Health Mobile Medical Care Educational Series. Hi, I'm JV Powell, Director of Implementation Services at Paired Health. The purpose of this video is to introduce you to the essential elements of a mobile medical office bag. A bag like this would be used by providers to drive care outside of the hospital into the patient home. Let's take a look. So the first thing you need to think about when assembling your mobile medical office bag is a good solid bag. We find this Wegner Patriot rolling bag to be a good one for easy transport in and out of the patient home. It has wheels with a extendable handle for pulling or carrying however the provider wishes. Then of course small pulse ox and a portable carrying case to be used during the exam. We find many patients have their own glucometers obviously, but it's handy to have one that we know is working. So ones like this Bayer Contour seem to be sufficient for stocking your mobile medical office bag. Then of course stethoscope. All providers carry their own stethoscope, but including here in the list for completeness. Having an array of different sizes of blood pressure cuffs is necessary from what we've found. So carrying multiple sizes to ensure accurate readings on all patients, i.e. carrying arm cuffs and both arm cuffs and thigh cuffs. Then a mobile otoscope set comes in handy. Small sets like this one in a portable carrying case can be purchased for a modest price on Amazon.com. For sanitary reasons, we find that forehead thermometers to be the best for this care setting and scenario. Ones like this Braun thermometer have proved to be fairly accurate when getting readings from the patient. Here we have a medical tape measure for multi-purpose use during the exams and a reflex hammer. We carry a basic set of bathroom scales that can slide right into the previously mentioned Wegner bag. These a thin set of scales when placed on a hard surface in the patient home would be best used to get an accurate reading of the patient's weight. A lot of the patients do have scales in their home, but we find that they're not always the most accurate, so we like to have our own set of scales. We keep a box of disposable exam pen lights handy at all times. And here's an important one. It's immensely useful to have mobile Wi-Fi access like this Verizon Jetpack hotspot. Having this as part of your mobile medical bag allows you to make real-time edits to the patient chart in the hospital's EMR, as well as access educational material online. The benefits here are endless as far as having mobile access to the internet and the ability to connect your laptop or tablet to Wi-Fi. And this is highly recommended for anyone who's considering mobile care, the mobile care setting. We've also found it beneficial to carry a handful of cheap USB flash drives. Oftentimes we'll download some of the visit records or other materials to one of these USB drives and give it to the patient for easy transport back to their primary care physician, and just for record of what happened during the in-home visit. Of course, after each visit, you obviously want to sanitize, so keeping a bottle of any hand sanitizing gel is a must. And then having extra sets of batteries for all of your equipment that's battery powered, so that you never know when the scales or the glucometer or pulse ox will go dead and you may need some more batteries. Depending on your particular program, you may want to equip your medical bag with some other supplies. For example, if you have several patients discharged on Coumadin, it may be helpful to have a PT-INR machine like this Alere machine here in your mobile medical bag. There are some other items that we've found useful to have available in the car. A mobile printer and printer paper like this HP OfficeJet 100 mobile printer here. It's battery powered and can be carried into the patient home for printing out visit summaries and educational material. It can actually fit into the Wegner bag with all of your other supplies as well. Mobile phone car mount. This just provides ease of navigation for the provider to navigate themselves from one patient home to the next. A lab specimen transport bag. If providers are doing labs in the home, they would obviously need a lab specimen bag like this one here for transporting the labs back to the hospital. And then also a sharps box. So you need to have a biohazard sharps box to properly dispose of lancets, syringes, IVs, and other biohazard materials. And then when a provider is out for a full day of visits, they need to make sure that they're able to keep their laptops fully charged so they're readily able to access the EMR for each patient encounter. So a car, AC/DC power inverter like this one here has proven to come in handy. Finally, you want to make sure that you keep your mobile medical teams well stocked with all the disposables needed for their daily visits. So some glucometer test strips, PT-INR ratio strips, obviously both a match for the make and model of devices that you have. A box of lancets, a couple boxes of exam gloves, maybe some Hemocult cards, gauze pads, both sterile and non-sterile, and we found it useful to carry a couple of different sizes, so maybe some 2x2s as well as some 4x4s, alcohol prep pads, and some surgical masks. With these items or some variation to suit your particular needs, your mobile medical care team should be well equipped to deliver effective care to your patients in their home. Thank you for watching this segment of the Paired Health Mobile Medical Care series. Remember to check out the rest of our series and much more at www.pairedhealth.com.